There we are. I have the pleasure now of introducing Dr. Scott Hyman. Scott is a licensed clinical psychologist and board certified in addiction psychology. His research interests include the effect of stress and trauma on drug cravings and the course of addictive disorders, medication development for addictive disorders, and cognitive, behavioral, and motivational interventions for psychological trauma and addictive disorders. Sounds like a lot. Scott, we're really excited to have you here, and I'm going to pass it to you. Or maybe not.
Lost Scott. I think he spotted that he was frozen, so he's maybe intentionally dropped off to try and rejoin.
So I'll go ahead and pull up his slides while we anyways.
I know some others have just joined us. And so if you joined at that very moment, we just lost our speaker. He'll be back in just a moment.
Yeah, this is how technology works. It's just is what it is. Give it a minute here. In the meantime, y'all can see the screen, right? Yes.
Yep, it's great. Well,
everyone,
while we're waiting for him, maybe I'll just kind of like add a couple of thoughts here that I'm really excited about. I think we're, like having Scott come and present is a huge opportunity for us. I think what Scott's trying to do is really challenge sort of the status quo in the clinical world. And so it's going to be really interesting to kind of hear some of the things that he's learned and some of the ways that he's thinking, and be able to talk a bit more about how Phoenix is really doing the same sort of thing by leveraging, connection and community to mainstream healing and really empower people. So I know I'm particularly excited to hear what he has to say. Have we gotten him back yet? Do we need to message him and see if we can help him?
I don't think he's back yet. Aspen,
Okay.
I can jump on an email.
okay, sounds good.
I know he mentioned too that he had some of his students that were going to be joining. I'm curious if any of his students want to kind of tell us who they are. I'm excited to see that we have some other folks from outside the Phoenix here.
Yeah, hey guys, I'm Dylan. I'm actually under the HRSA grant with Dr. Hyman. And he's actually told me about Phoenix, and the strength-based exercise training model as well. So when I saw that you guys were having a meeting, I'm like, I had to join this. But under the HRSA grant, we're working with substance use disorders and substance use patients. So that's sort of the field I want to get into once we graduate.
Oh, that's awesome. What year are you, Dylan?
So I'm just wrapping up my first year. Next week is going to be my last week of my first year, then jumping into year two.
Awesome. That's really cool. Well, we're excited to see what y'all kind of get out of that HRSA grant. And anyway, we can help. Just let us know.
Absolutely.
Scott, you're back.
Yeah, I had a little Zoom crash. I never had that before. So here we go.
No worries.
Way to start.
We are ready when you are. So I'll go ahead and just go to that next slide and keep me posted, okay?
Sounds good. So should I get started? All right. So I first wanted to start by just saying, like, I love what you're doing with the Phoenix. I learned about this at our psychological addiction conference a couple of months ago. Dr. David Eddy was speaking about some of the work you were doing at the Phoenix, and I was like, oh my gosh, I need to be a part of this. I love this so much. Something about me is, I'm very much a fitness enthusiast. I'm a psychologist, but I love exercise. I lift weights. I play basketball 2 to 3 days a week, and I play with, like, we have a group of guys that come down to the park or the LA Fitness, and you can get sometimes like 15, 20 guys, and they're there. They come different times, and rarely talk about what we do for a living, but once in a while it does come up. And, and when I tell people what I do, it's amazing how many people start telling me how much this meetup, the exercise, the playing ball together, the social aspect of it is so important for their own mental health. Like I need to do this, and I can totally relate. And we look forward to it. It's fun. It's interactive. I mean, you do have the other fitness components, but there's something about that team sport that I think is so important for wellness, and something that in my own history, just, getting involved in fitness and wanting to learn more about it. I think when I was younger, back in the 90s when I started exercising and lifting weights and trying to, grow from a skinny kid and just get stronger, um, we didn't know what we were doing. There wasn't all this information out there about, principles of fitness and all the science around it. So, the mentality was like, well, just go in there, beat up your muscles for an hour and you're going to get bigger and stronger. And, later on as I grew and, and I evolved and, more information became out there, there was so much interesting information about how people can improve their physical strength, how they can improve their speed, their agility, their flexibility, their muscular endurance. And there's actually like these fantastic principles of exercise training that basically say, pretty much regardless of what you do, what type of fitness you're interested in, whether it's like Pilates or strength training or um, gymnastics, if you follow these principles, you will get stronger, you'll prevent burnout, and you'll grow. And when I read about this, my mind started going, my psychologist mind, and I started thinking, wow, I think that these principles may actually be applicable to some of the types of psychotherapies that we do, particularly the type of therapy, that I practice, which is called cognitive behavioral therapy, which is very much a skills building type of therapy. It's a very focused therapy. It's very structured. There are very specific goals, and it very much, I think, aligns with what we do or what exercise physiologists do to train people to improve all of these muscular functions. And that's what I was going to talk about today. And, these are, I think, new ideas, but I think um, what I'm trying to get out there is that, this may be a way to conceptualize psychotherapy, not so much as a method to eliminate disorder and disease, but actually as a way to build strengths. I want to discuss, how these principles align with the practice of psychotherapy, how they might align. Some of this is very theoretical, but there is actually some good research supporting these principles as applied to psychotherapy. And I think if we think about exercise this way and psychotherapy this way, it actually might reduce some of the stigma involved in psychotherapy. One of the biggest problems we have, particularly with addiction treatment, is that most people just don't go. And so, even though I very much believe in this recovery capital that you're doing with the Phoenix, and these are fantastic things, and they're so important. We have to do it. I also believe in psychotherapy, and I think if people can engage in both, I mean, we will really be able to improve people's ability to stay focused on their growth and their sobriety, and not only just to get to a level where they're functioning okay, but where they're actually thriving and they can actually grow beyond. And just like exercise is not just for people that may have, walking and movement difficulties, which it is. It's also for everybody. It's for people that just want to improve themselves. And I think psychotherapy can be seen as the same way. So we can go to the next slide and I can take you through some of these principles. But first, like when you think about the parallels between exercise and psychotherapy, I mean, there are some really incredible parallels there. I mean, they're both focused on changing behavior to improve health, wellness, and functioning. They both involve practicing certain movements, behaviors in a specific way and growing in those ways to improve a person's ability to function. So, we practice maybe improving someone's skills. We practice having them learn how to regulate emotions better. We practice having people learn to recognize when their thinking is maybe not very helpful, and different ways to think in more proactive ways. With addiction, for example, people struggle with addiction-related thinking. Their mind takes them to types of thoughts that can put them at risk of relapse. And so, we try to strengthen a person's ability to recognize, scrutinize their own thinking, and try to think in more healthier ways. They both have strength and a skill-building emphasis. And like I said before, they're really for everybody. It's not just for people that are sick or disordered. These are things that anybody can benefit from. And they're both evidence-based. There's a lot of good science supporting, you know, uh, that if you follow these principles, you will improve your physical abilities, your physical strength, and your health. And just like psychotherapy, there's a lot of good research supporting what we do as far as helping people improve their mental functioning, their behavioral health. We can go to the next slide. Excuse me, I'm gonna take a little water here. So if you look at the literature on exercise physiology, and we think about these different principles, and like I said before, the idea is that if you follow these principles, you're going to improve, you're going to prevent burnout, and you're gonna grow. And I'm going to take you through these different principles and show you how we might be able to apply those to how we do psychotherapy. So we can go to the next slide. I'll start with individual differences. Basically, individual differences is just the idea that, we're not all the same. People have different backgrounds. People have different preferences. People have different tolerances to different types of treatments, just like people might not respond the same way to the same exercise routine. And we have to really consider that, we're not all going to respond the same way, and we're not all going to be interested in the same types of treatments, just like people are not interested in the same types of exercise, and they're not interested in, and they're not going to respond the same way to the same types of exercise. So we want to understand that and present people with a menu of options that they can look toward, when we do our psychotherapy. We want to meet people where they are. People may not be at the same level of motivation. Some people just may not be able to even do the same types of psychotherapy because they just don't have the time for it, or they have other responsibilities. So, we want to consider that. And so when I'm thinking about when I'm working with people, when I'm working with students, when I'm sitting down with a patient myself, I'm thinking, am I considering this person's individual differences in what I'm doing? And I think that's one of the most important steps as we move forward. So we can go to the next slide. And the next principle is specificity. And specificity, again, that comes from exercise. And basically what that says is that if you're going to try to improve a particular strength, like for example, if an individual comes into the gym and he's saying he just wants to be able to go up a flight of stairs more easily, you're going to do certain exercises that are going to help that person be able to move up that stairs more easily. And you're going to practice those exercises in a certain manner, in a safe way, so that that person can improve that strength. They might do lunges, they might do some squats, they might do some leg presses on the press machine, but that person's not going to be swimming in the pool. I mean, even though swimming in the pool might have general health benefits, that's not going to be the primary focus of the training if the goal of that person is to improve their ability to go up a flight of stairs. And the same thing for psychotherapy. I mean, sometimes, people go in there and, we're kind of, doing supportive therapy, which is important, and you want to help people be able to, get support for their difficulties. But at some point, we really need to have a strategy, and we need to have a plan, and we need to think about what is it that this person is looking to improve upon, and in what area of life are they looking to improve it, and are we designing our interventions to help that individual? So, for example, you could have 10 people that have the same diagnosis. A medical provider might say, well, you have depression, you have depression, you have depression, so I'm going to give all of you a particular medication, and hopefully that will make you feel better. And what we do is a little bit different, because you have one person that their depression might be more related to an inability to regulate their emotions well. And you might have another person that their depression might be more related to, distorted thinking patterns that they have. And then you might have even another person that it might be related to a behavioral skills deficit, that they're not really able to talk well and speak well to people and build relationships. And that's why they're having a depression. And we want to figure out for that particular individual, what is the targeted focus of the intervention, and what are we going to work towards to help that person achieve that particular goal? So it has to be very specific. So we have individualized and very specific. And same thing for exercise when we're trying to build muscles and strengths. We can go to the next slide. So, hope I'm not going too fast. The principle of reversibility. This is basically the idea that if you don't use it, you're going to lose it. People can build up strengths, people can build up muscle, people can build up speed, agility, flexibility. But if you don't maintain the work, you will revert back to your old ways. Your strength will decrease. Your muscles will be reduced in strength. So people have to keep this up. And when we look at exercise physiology, athletes, people that are involved in fitness, they never stop. They might change how intense their workouts are, but they never stop. They might take some breaks at certain points, and that's important. We'll get to that later, but they don't stop. And I think the same thing may apply to psychotherapy. Even though you might work with a therapist for a couple of weeks or even over months or even years, sometimes people think, well, I addressed my problem, I'm okay, and I don't need to do anything else about this. And what I think is important is that we need to always think about pretty much like a relapse prevention plan, or a way to keep these strengths improving so that this person can not only maintain their gains, but actually move towards actually thriving in the future. So just as you might work with a trainer in the gym to improve your strength and your functioning, and you might eventually get to the point where you can carry on these behaviors without the aid of that trainer. Same thing I think goes for psychotherapy. Even though you might learn these skills and have the support while you're in the therapy with that therapist, if you don't continue practicing these skills on your own every day, you're going to put yourself at risk of reverting back to old ways, or what we might consider relapse. So you always have to have this plan. And I think, again, another thing that I'm thinking, okay, so are we looking at this individualized? Are we being specific? Do we have a reversibility plan? And can we make sure that our patients and that we are aware that this has to be something that we maintain for the long haul? So we can go to the next slide. So principle of progressive overload, this is probably one of the most well-known principles of exercise physiology. People know that if you stress the muscles beyond their normal level of use, the muscle will adapt to the new demand and it will grow in strength and size. People practice doing certain movements regularly, a couple of times a week over years, and if you follow the principle where you increase the weight, you increase the stress, the muscles will adapt and the person will grow. I think this is absolutely applicable to psychotherapy. When we work with people, and I'm thinking about, think about like trauma treatment or anxiety disorders. One of the interventions that we often do is something called exposure therapy. And there's different ways to do exposure therapy. There's one way that people have tried that's called flooding. And flooding was basically like you put the person in the deep end of the pool, and the belief was that this person would have this anxiety peak and an extinction effect. And that might work for some people that can tolerate that. But when you looked at the studies, there was actually a lot of dropout when they did that with people. And so a better way to do exposure therapy is you start small and you work with people and you have them, expose themselves to less anxiety provoking situations before they move to more anxiety provoking situations. And so again, thinking about this principle, are we considering progressive overload? And I think, and this is, my thought, is what we're seeing actually what this extinction effect is? Or is what we're seeing is that this person is actually building up their strength to be able to tolerate these anxiety-provoking situations. And as we continue in a progressively overloaded way, can this person build up that strength? And can we apply this to so many different things? Can we apply this to practicing mindfulness? It's not easy to just be a mindful, like a Buddhist monk and be able to meditate for hours on end. You have to build up to that. You have to start small, and you have to understand that you're not going to start on the treadmill at the highest level right away. And the same thing goes for these different skills that we're trying to teach people to do. You might, thinking about alcohol, for example. I know this group is interested in, working with people with addictions. We might have somebody actually start to practice trying to manage cravings in less tempting environments. For example, I put an example like maybe going out to brunch with the support of a sober friend in a restaurant that they haven't been to in a while with and having that support where the risk might not be that high, and they can learn to develop that sense of mastery, that sense of self-efficacy, that ability to say, hey, I can be here, and that craving is something that I can tolerate, and I can let it kind of pass, and I can move on with my life, and I can actually learn to live. And you would do that before you would actually maybe have them expose themselves to situations that might be a little bit riskier. And I know some people might not like hearing this and might say, well, people should be avoiding people, places, and things associated with alcohol if they're trying to stay sober 100%. I just don't know how realistic that is. I don't know how much that really is living. And I'm not saying you would do this right away, but over time, as the person develops that strength to tolerate these situations, to build up that self-control muscle, they can start to become more able to be out there and live a life that, yes, they're focusing on the sobriety, but they're not giving up all the other things of life that are important and give them meaning and pleasure. You might even have, following this progressive overload idea, is maybe have, earlier phases of treatment focus more on things that are less intense, and then later on build up to engaging in interventions that might be more intensive. And I think a lot of therapists, we're not thinking this way. And I think patients need to also understand that, hey, I need to start small and build up to this because I am not going to be there right away. I have to understand that I'm not going to put 100 pounds on that weight bench, and I'm going to do that if I've never exercised before. And I think if they understand that and we understand that, we're all going to do a lot better. So we can go to the next slide. Principle of hard, easy balance. That's what you might see in the literature. This is the idea that, even though you have to stress the muscles to improve, people also need periods of rest for recovery because the muscles grow when the person's at rest. And what this is going to do is this is going to prevent something that's called overtraining, burnout, injury. And I think the same thing applies to psychotherapy. I think sometimes we come to the therapy situation, the patient might come to the therapy situation and might think that more is better. And there are times, again, going back to thinking about like this trauma treatment. I mean, you have to listen to the patient. Sometimes they burn out, they're exhausted. I think you really want to think about, interspersing periods or sessions that might be more intense with other sessions that might focus on more kind of like recovery type interventions, like helping people learn to relax. And sometimes some of the things we do are very intensive: trauma treatment, addiction treatment. Sometimes you're talking about, very disturbing memories, horrible things that have happened in your life. I mean, this can be very exhausting. And, and if we're pushing our patients to continue to talk about this without considering that this person might need some rest and recovery in there, we might push them towards dropout, burnout, and we don't want that. So we got to listen to our patients. We need to be aware of this ourselves, and we need to consider that we want to always think about, hard, easy periods of recovery, even when we're doing psychotherapy, just as an exercise physiologist or trainer would work with a client of theirs or a coach with an athlete. How am I doing for time? Okay, we're doing okay. Maybe one more second. So periodization is a principle that really kind of ties together all the other principles, and I'm talking about this as someone that's not a trained exercise physiologist. I'm talking about this as just somebody that's read about this. So, you know, I would love to, when I met some other folks from the Phoenix, it was kind of like, it was like a really nice opportunity for me to maybe learn a little bit more about that field as well. But this is all, you know, based on my own study and my own readings, my own research, and thinking about how this could be applied to psychotherapy. But periodization is really a planned way of working with people, athletes, uh, people that are training for a particular competition. And it's about really like changing the focus or the intensity of the training in different parts of the year. So as somebody maybe might be gearing up for a competition, they would step up the training. As there were periods where there wasn't competition, the person might dial down the training. They would never stop the training, but they would change how they planned it over the year. And again, I think this is very applicable to psychotherapy. You know, there are times when I think about addiction treatment, for example, there are times when, you know, I've worked with patients, you know, things are going well, you know, the time of the year is fine, they're doing well, they're making progress, you know, we're doing therapy maybe once a week, but then they tell me, look, you know, what's coming up? It's New Year's, it's Christmas, it's, you know, the Wednesday before Thanksgiving. These are tough party days, you know, or they are coming across an anniversary of the death of a loved one. And, you know, they know what's coming. They know that they're going to be stressed out, and they know that they're going to be more at risk of relapse during those times. So we would plan for those, and we would think about, okay, let's dial up the meetings a little bit. Let's focus on what's going to come soon, and let's practice for it. Let's role play. Let's think about, you know, how you're going to deal with those situations, and how you're going to deal with that stress, and how you can get through that without relapsing back to your old habits. So I think, you know, if we have kind of like this plan and this periodization, you know, tying together all of these different principles, we can help people improve their strengths. They will grow. They will prevent burnout. It will prevent relapse. And this is a way I think we can think about, you know, doing our psychotherapeutic work. So we can go to the next slide. So what are my conclusions? You know, I'm thinking about this as, when I put this together, as a model that might, you know, be a better model for what we do than what we typically follow as psychotherapists, psychologists, which is the medical model. I mean, we really don't treat disease in the same way. What we do as psychotherapists is we help people live better. And I think that's important. And I think what we're doing, whatever diagnosis you have, even if you don't have a diagnosis, we are trying to improve these particular functions. We are trying to improve these particular strengths, whether it's the ability to tolerate and cope with stress better, the ability to control our thinking and our behaviors and our emotions, our ability to, you know, engage in relationships in a better way. And yes, does that lead to improvements in a diagnosis? Absolutely. But we go about it in a very different way. And I think if our clients, our patients, and therapists could really consider these principles that guide strength training and improvements in physical fitness, we could actually learn from this and apply that to our psychotherapeutic work and help people grow in the same way. So I think it's beneficial to consider these principles. You know, we want to think, okay, am I considering individual differences? Are we being specific? Is there a plan for relapse? Are we considering reversibility? Are we engaging when we do certain therapeutic activities? Are we engaging in progressive overload? Are we kind of starting small and moving up? And are we getting to the point where this person can continue to grow in their functioning? Are we considering hard, easy balance? You know, is this person burning out? Are we pushing too hard? Do we maybe need to take a little break for a little bit? You know, and I think as therapists, if we think about these principles in our own work, I think our own work can be enhanced and it can be so much better. And I think if people understood psychotherapy this way and what we actually do, it might actually encourage more people to go to treatment. And yeah, I think just really, you know, keep doing what you're doing with the Phoenix, but also consider that there might be some benefits for engaging in some of this psychotherapeutic work. And that concludes my talk.
Thank you so much, Scott. That was great. I know that we have a lot of folks who may be dropping it. We don't always, I think, we created a very concise format for these talks, which sometimes holds us back a little bit. And I think we're exploring the idea of making them a little longer so that we have a little bit more time to kind of dig in on some of the kind of like wonderful content that is shared. But I do want to just say, like, if anybody has any questions from the audience, let's first get those kind of into the chat or raise your hands, and we'll, be sure to get those questions in front of Scott. And if folks are able to stick around, and Scott, depending on your schedule, like, we can kind of bring this to closure whenever is ready for you.
I'm
But
open.
you're open, cool. So if we can continue to chat.
I wanted to add that I have the article, if anyone's interested, the article where I first wrote about this is available in the reference section, or if you email me, I can send you a copy if you're interested.
Beth, maybe we can drop it into the chat as well. I know we've sent it to each other, so we've got it in our emails.
Great.
Yeah. Any questions out there? Great. Carolyn.
Hi, everyone. I'm in the same cohort as Dylan, who spoke a little earlier as well. And my interest is in military psychology. And I find this article to be so incredible for that population. I think it has really great potential for it. When I just came from a conference, a military conference, and they mentioned how sports psychology is now an official fellowship that you can do through the military, and they're incorporating it more with their psychologists who are embedded in units like Marine Corps units and things like that. As someone who wants to do that specifically, what is some advice as to how to incorporate this like out in the field, for example, where you are partaking in a lot of physically demanding, exercises where you can kind of like slip this in?
Well, there was actually something I did talk about in the article was there is actually I think it was Martin Seligman, who is a pioneer in some of this work, and they were doing like these mental fitness trainings for active military. So there is definitely, that happening. It's just that I don't know if they're really following these principles in that same way. And that's where kind of like I added, I think, to this. It's like, is there actually um, a model that we could follow when we're trying to improve these strengths? So not just improving the strength. There's actually some work, for example, by phenomenal work that actually inspired some of this by Roy Baumeister. He's a psychologist. I think he's at University of South Florida. And he actually conceptualized with his team self-control as actually a muscle that will fatigue with use. So the idea that, if you spend time, engaging in activities that involve self-control, you will actually fatigue that muscle. And then if you're faced with a later situation that involves self-control, you're going to be less able to control yourself in that situation. And it kind of really much aligns with, the work we do with addiction, because the idea is like, if you're spending a lot of time controlling yourself, controlling yourself from engaging, acting on a craving, or controlling yourself from, getting upset in a relationship, and then later on in the day, you're faced with a situation that involves self-control, like someone pulls out and says, "Hey, let's do some lines of cocaine." The idea is that you're going to probably be less able to control yourself in that later situation. And so some of the work that they were doing was actually having people practice activities that involve self-control interspersed with periods of rest, and actually trying to improve that self-control muscle, just like you would do with, physical exercise. And so there is some, work in this area. They didn't talk about these principles, but it's there. And there is some evidence supporting that we can do some of this work with people. I'm not sure if that answered your question, but
That's really cool. I'm gonna look into those people that you were mentioning as well.
yeah, Mark Moravin, Roy Baumeister, they've done a ton of, they call it it started with kind of like willpower, but they call it ego depletion. But it was really like a strength model of self-control, which is really interesting.
Thank you so much.
Scott, I think the thing that's really interesting here in this conversation that you and Carolyn are having too is that there's just so much room for innovation. I think it's a recognition that, what we've built so far within the way in which we deliver clinical care is sort of just scratching the surface. And that if we just stick with this one way of doing it, that we're actually we're leaving value on the table, right? We're not really serving people in the most impactful way. And so Carolyn, I think taking the references that he's shared and also thinking about like, what might I test? What might I kind of build that applies these principles with this specific, kind of group of people? And how can I evolve the science? Like, you are well primed to do some really amazing work.
Absolutely.
Yeah. Lucy.
Hi, everyone. I'm also a student from Albizu. I just wanted to say, Dr. Hyman, this is an amazing presentation.
Thank you.
Although I'm in the neuro track, I think everything intertwines with itself, and I think a lot of us come across wanting to dabble. And I've come
What's
to
not neuro? Everything happens in the brain. What's not neuro,
yeah,
right? It all happens up here anyway. So
yeah, and I've come to like most of all your presentations. So I'm just really I'm so motivated by this presentation that I actually want to apply it with one of my patients with borderline. So my question would be, how can I do so? Like, how she exhibits a lot of these things that you've been explaining, and then that impulse control is not there, and she does a lot of irrational decision makings, and she tries to do some. She told me about fitness actually, but we've never been taught these things, so I didn't know how to use that into my psychotherapy. But if you
I mean,
can get that.
I think you gotta look at the evidence-based work for working with people with borderline personality disorder, like dialectical behavior therapy, which does have a very much a skills building emphasis. They focus on, improving emotion regulation, distress tolerance, mindfulness, and interpersonal connectedness. And I just think that you can also just, as you're doing that work, think about, am I considering individuality? Am I considering this person's individual tolerance for things, their preferences? Am I being specific? Okay, are we engaging in emotion regulation skills training that are focused on what's going to help this individual in her areas that she wants to improve in? Not in general, but specific to her. Is there a plan to practice these skills so that she doesn't revert back to the old ways? So reversibility. Are you starting small, with the mindfulness, for example? Practice some more basic mindfulness skills before you move up to ones that are a little bit more intense. So that would be progressive overload. So you're doing the mindfulness skills, but you're considering the principles of the exercise. Hard, easy. Are you listening to your patient? Is she telling you that this is too much? I'm feeling overwhelmed. Maybe you need to kind of take a back off a little bit and focus on things that might be a little less intense. Bridging these two fields. So looking at the evidence-based work of dialectical behavior therapy for people with borderline personality disorder and considering these principles, I think you're gonna do much better work than you might if you just did one without the other.
Wow, thank you so much. I'm gonna instantly apply this, but thank you.
But talk to your supervisor.
Yes,
That's who you need to talk to.
thank you.
God, as I'm hearing kind of Lucy's question, I think what comes to mind for me is how we can adapt some of the principles that you've shared here with our community and thinking about ways in which we can mainstream healing sort of in this everyday environment where people are helping one another. And, when we built the Phoenix, as a clinician first and a researcher kind of second, I think we really tried to draw upon some of the learning from those environments, from the clinical environment, to say, like, how can we again mainstream that? Psychological safety is something that's become really critical in our work in creating an environment that is, supportive, where people can show up as they are. And thinking about Bandura and his theory around social cognitive theory and self-efficacy, like, how are we helping people by giving them opportunities to see other people achieve their goals, by hearing about it, by actually doing it themselves. Like, so we're constantly thinking this adaptation of what works well in the clinical environment that we can draw upon, what works well from the fitness industry, as you've talked about, that can be drawn upon in the everyday environment. With this in mind, are there maybe one or two things that you can think of from the principles that are really easily adapted in this peer-based environment that we could share with our members that help them think about ways in which they can take control of their own recovery and flourishing?
I think about, the work you're doing and, the stuff that I'm talking about, I want to also make the point that, a lot of this is this kind of somewhat theoretical, although there is some evidence supporting these principles. It would be great for me or anybody to actually start testing some of these out, and really seeing, like, does it make a difference if we kind of consider these in our therapeutic work? I think it makes sense, like I said, and I think there is actually evidence out there from other researchers supporting these principles. There are really great recovery models of care. And I think an important thing that people need to understand is that, what we do, there are different routes to recovery than just going to see a medical provider or a therapist. Like the work that you're doing, people are improving by engaging in these social activities through the Phoenix, and it's working. And you have to listen to your client. Medical providers need to listen to their patients, and again, like I said earlier, you need to present people with kind of like a menu of options of things that are going to help them. And psychology really follows from more of a medical model. I mean, we are taught to diagnose disorders. We are taught to treat those disorders. And, interestingly, like you could have people that have the same disorder, they meet the criteria, but they're meeting different criteria. And there's different severities of those criteria. So what might work and improve one individual might be very different than what improves another individual. And so you always have to think about each person as an individual, talking to that individual about what is going to make their life better, what is going to give their life meaning. I mean, I think some of the work you're doing with the Phoenix, it also coincides with very important behavioral principles. I mean, the idea is that if you can find enjoyable, meaningful activities that compete with using drugs, that's wonderful. That's one of the reasons AA and NA work, is because when you're at a meeting, you can't be out there drinking and drugging. So it's a similar kind of idea. What's most, I think, better about the Phoenix, for example, is that they're doing something that's fun and is that social connection and it's meaningful and it makes you feel good. And so you're getting this feel good experience, and you're learning that that doesn't have to come from a drug, and it's rewarding. And the hope is that if something's rewarding, you're going to do it again and again. So like these principles were kind of more something that I kind of saw aligning when I was just kind of going down the rabbit hole of exercise physiology and learning a little bit more about it. And it was just kind of like this, one day something just hit me in the nose and I said, wow, these are some really cool principles. If you follow these principles, you will get stronger, faster, and maybe the same principles might apply to the work we do in psychotherapy. And that's what I'm trying to get out there. And I think if people that are interested in and they need help and they're interested in engaging in psychotherapeutic work, or maybe they have other issues that they need to deal with, trauma, depression, anxiety, in addition to the addiction problems that they have, I think this might be a way to help them understand that therapy might not be what you're fantasizing it might be. I think sometimes people think they're sitting on a couch and, Freud's analyzing them and they're talking about their dreams, but that's not typically how it works anymore. It's very practical. It's a learning, it's a teaching, it's practicing, it's real world. What can you learn to do right now that's going to help you think better, behave better, cope better with your emotions, and live better ultimately? And that's the work that we do. And whether that, you know, it improves the diagnosis or not, whether they have one or not, people get better. The problem is you have to go to treatment, and that's where we're having a difficult time. People don't really understand what we do. They just don't know. And that's something that I've struggled with addiction. People don't know the medications that are out there for opioid addiction that reduce overdose risk by over like about 50%. They just don't even understand what's out there. So I think we need to do a better job in educating people about the treatments that are available, but also helping them understand that they might not really be what they're expecting. And if they actually understood what really goes on in therapy, typically, they might be more likely to actually go.
Yeah, I think it's really interesting, you know, this idea of looking at healing from a multidimensional lens and recognizing that treatment can play a really powerful role, and that these other approaches, these, you know, the community approach like the Phoenix takes, you know, another organization called Seek Healing really focuses on social health, right? These other types of interventions and practices can be really powerful in their own right. And that there's probably no one right way, and that what people need may change over time. And so
Absolutely.
you need different things in different times and different doses and in different mechanisms. And I think that's something to really kind of keep in mind, because you're really talking about a paradigm change. You know, I think historically our norms have said, you know, we have this medical model, you go to a doctor, they're going to fix you, they're going to treat you with a medication or a surgery. And even in the medical field, we're realizing that actually that doesn't work either. If you look at cardiovascular disease or diabetes or even cancer, we now know that the root cause, you know, a lot of these things we can do to prevent exposure to different chemicals, exposure to different foods. Like there's things that we can take control of in the everyday that if we did that, we actually wouldn't even need the medical care that's happening. And then when we do get diagnosed with some of these medical conditions, there are things we can do to improve our outcomes, again, through diet or exercise or social connection. And I think that is something that maybe the clinical world is really starting to embrace and understand, and you've talked about. But I don't know that society as a whole is understanding that they have a role to play. And it's not about relegating them to total responsibility. Like you don't necessarily, you're not going to do your own surgery to take out a tumor. You know, like if you're dealing with very traumatic kind of situations, or have a complicated mental health challenge, you need clinical services. But there are lots of ways in which we can mainstream healing beyond that. And I think the types of things that you're talking about, taking something that's fairly low risk, frankly, the way in which we promote behavioral change through fitness is a perfect example of how the clinical industry can advance this paradigm shift, and looking at analogs that maybe aren't aligned with that more traditional expert top down way of delivering care. And then for the Phoenix, thinking about ways in which we too can mainstream healing. And I think by doing that, we have an opportunity to really change how our country approaches addiction and recovery and wellness more broadly, that frankly takes some of the burden off of the traditional clinical systems by letting us do our part in a comparative advantage sort of way, where you know, the clinical providers get to do their part in a really impactful way. So I just love that you're challenging some of these norms, you're creating pathways to more innovation, and also recognizing there's some research to be done. You know, there's a lot of us that need to get out there and do this research so that we can start to put some proof and really kind of bring even more to the kind of conversation that challenges the way things have been done so far.
I just want to say I saw your TED Talk and I loved it. And I remember something you said was, you know, people are not their disorders. And I think that's important. And I would add to that that, you know, we don't treat disorders, we treat people. And so, you know, we have to consider, you know, that particular individual. You know, we're not just trying to eliminate a person's disease. We're trying to help this person improve in so many aspects of their life, their relationships, you know, their cognitive functioning, their ability to kind of find pleasure in life. I mean, in the end, we're trying to help, not just help people feel better, we're really trying to help people live better. And I think that's our goal. And I think if we focus on that, the diseases, whether you call addiction a disease or a disorder, they're going to go away. But we do it through improving a person's ability to live better. And I think that's what you're doing with the Phoenix. And I think that's how I think about, psychotherapy when I do the work that I do.
Well, Dr. Hyman, this has been an absolute pleasure. I want to thank you so much for sharing your work and taking a little extra time with us today to answer some questions and kind of have this deeper discussion. I think, I don't know, I'm just really excited about what you shared today. I'm going to think about it myself and with the Phoenix team to kind of understand how might we kind of look at some of these principles in our work
Awesome.
and what we might be able to do in mainstreaming it a bit. And then, continue this conversation and see where maybe some future collaborations might
Absolutely.
be
My students
possible.
and I, maybe we can all, connect with you, and there's definitely interest.
Awesome. Awesome. Anything else from the Phoenix team?
Just going to quickly plug, especially with this group, that our next event is coming up on September 16th. It's not live to register just yet, but we'll get that link out when we send your follow-up email. I think it might be interesting for you in particular because it's thinking about how warmth can serve as a protective pathway for alcohol use disorder. So maybe some of y'all would want to attend. Just thought I'd plug it while I could. But otherwise, yeah, no, I think we've covered what we needed to cover. And again, thank you all for being here. Thank you, Dr. Hyman. It's been eye-opening. It's been a pleasure. And yeah, hopefully we'll see some of you guys on New Form. So yeah.
Great. Thank you for having me.